Hi, this is second part of video how to choose perfect minoxidil 5%, 10%, 12.5% or higher concentration. I am Dr. Satyajeet, MD dermatologist, hair transplant surgeon and hair expert. If you are a female patient, start with 2% minoxidil 1 ml twice a day. And if everything is fine, like there's no itching, irritation, unwanted facial hair, you can switch over to 5% minoxidil like Mintop Eva with 1 ml application once a day. But if you are a male patient and starting minoxidil, start with 5% plain minoxidil. If after 3 to 4 months use 5% is not effective, then try for 10%. According to many studies, there is no difference between 5% minoxidil or 10% minoxidil. But yes, if you start directly with 10%, chances of early shedding is very high. Many patients switch over to 10% minoxidil when 5% is not effective and they find good result. More than 10% minoxidil solution is not a good idea in my opinion, because more than 10% minoxidil is not soluble in alcohol and it may cause severe minoxidil dandruff due to precipitate. One more thing, if you are looking for best minoxidil of best brand in maximum discount with treatment support, visit www.addonwellness.com. In next video, we will talk about minoxidil with finasteride or minoxidil without finasteride, which is good. Thank you.